It changed my life. I mean, it literally changed my life, and I would do it 100 times over again.
My stepmother is a Korean American dual citizen. It was cheaper to buy a flight to Korea to get your cataracts removed than to do it here.
I haven't been to a U.S. dentist in 14 years.
All right, so we're talking about 3 different stories here, but one thing in common: Americans going out of the country for cheaper health care. With the right research, experts say it can be safe. But as we saw just recently, it can also end in disaster. 4 Americans, 1 man from Winston-Salem and a woman and 2 men from South Carolina, traveled to Mexico so that the woman could get cosmetic surgery. Not even 10 minutes away from the U.S. border, that group was caught in a cartel shootout. 2 of the Americans were killed. The other 2 survived. One of them, Eric Williams, who lives in Winston-Salem, was shot several times but is expected to recover. WFMY News 2 spoke to his wife and mother, who shared this warning.
Stay away from Mexico if you do not understand what's going on. Stay away, because once you get over there, you don't know what kind of danger that you're facing.
Just don't. That's all I need to say. Just don't. I don't think he knew what he was going into. I don't think any of them did.
Well, today, a person claiming to be from the Mexican drug cartel responsible for that shooting and the kidnapping issued an apology. They released a letter condemning the violence and promising to turn over those responsible. They apologized to the families of the Americans and a Mexican woman who also died in that shooting. So now we ask, does the potential danger outweigh the reward? This whole conversation about traveling abroad for medical care and the whole health tourism industry centers around the United States healthcare system.
We have a lot of for-profit. There are for-profit hospitals. The insurance companies are for-profit. So when every piece of the medical system is trying to make a profit off you, then rates go right up.
Laura Packard is the founder of Healthcare Voices, an organization that advocates for affordable and comprehensive health care.
This is a United States problem. Surgeries are more expensive here than most other places. And there is a variety of reasons for that. I mean, most other countries have a health insurance system that makes more sense. You know, like Canada or the UK has, a national health service where there's one insurance payer. But even places like France and Germany, they have multiple insurance companies. They're just more regulated than they are here. Until we have better healthcare in America, I'm not sure that you're going to be able to stop people, nor would you necessarily want to, but people should be smart consumers, make sure that they're going to board certified doctors, that they're going to places that the US government doesn't say are dangerous.
If you do decide to make the trip abroad for healthcare, doctors say there are things you need to consider when choosing that provider.
It's really hard to know outside of the US what the training really is. There's a language barrier, but also I have had patients who are from other countries who've gone to their home country and still have problems.
Well, here in the U.S., plastic surgeons have to be certified by the American Board of Plastic Surgery. When it comes to doctors in other countries, well, the process just kind of varies.
There are a lot of surgeons who are trained in other specialties who call themselves cosmetic surgeons, and they may be good, but they don't have the training that a plastic surgeon has. The thing to keep in mind is that the standard of care for both the operating room and the post-pre-op period is much different in other countries.
Now, while it may seem like there are many good options outside of the U.S., Dr. Dillingham says you shouldn't discount what the Triad even has to offer you.
The main thing would be look at your own area first. First look and see, okay, who is in my area? We have some excellent plastic surgeons in the Guilford County area, in Greensboro. Here in North Carolina alone, we have some amazing universities, amazing health systems. Cone Health is top notch. Don't pass up what you have locally for the hope or the promise of something that's further away.
And of course, with the options that are close to you, shopping around is something that every consumer should do.
There's regulations that have been put into place in the past couple of years that hospitals have to start declaring their prices. So if you're willing to do the legwork, now you can see, you can look around and see where the best deal is.
How much you pay for a procedure changes depending on the insurance you have and at which hospital you're getting that procedure done. You can take a look at the cost comparison put together by the North Carolina State Treasurer's Office. It shows all 3 hospital systems in our area and the differences in prices. Now, this was back for 2021. That difference is linked to your insurance as well.
Can you imagine your viewers walking into any establishment and based on what type of credit card they have, they'd be charged different prices? And that's why
the state treasurer says every person, no matter what health plan you have, you need to look at the medical bills that you get, and you need to ask for an itemized bill, which breaks down all of the costs. And you need to question items that just don't look right to you.
It could still be the case that there is nobody performing your surgery in your area that is cheaper than going to Canada or Mexico.
All right, so we've heard about the dangers and now know there could be options here that may be affordable to you. So why go through all the trouble to go abroad for healthcare? Well, earlier you heard from 3 different people who have either been abroad or know someone who went abroad for healthcare, and they share more about their reasons why.
The financial advantage is the main reason that people, I think, kind of gravitate towards this. What was the most important to me was they let me advocate for my body and my needs. As far as like care and quality of care, it was absolutely top notch. And I've felt genuinely cared about, like, not that it was, and not that that's how it is here, but not that they were doing a job. They genuinely cared about, how I was doing, what I needed, anticipating my needs.
My stepmother is a Korean American dual citizen. She flew to Korea to get her cataracts removed because that was cheaper than getting it in the US since she wasn't on Medicare yet. So it was cheaper to buy a flight to Korea to get your cataracts removed than to do it here.
I haven't been to a US dentist in 14 years. I've had implants, I've had crowns. It's all very efficient. You got to go to the right clinics, though.
It's not for everybody by any means, but if you take the proper steps and you do your research and you take your time, I think it's a great alternative. It changed my life. I mean, it literally changed my life.
It's really sad that people were forced to go to Mexico for care they needed, and now they're no longer here. So that is just another example of how healthcare in our country is broken, and politicians on all sides need to get together and work to make it so that everyone can get the healthcare they need.